Hi everyone, my name is Megan Hill. Today I'm doing my reading presentation over the ELINX, the National Lab Data Standards for Electronic Health Records. So I'm going to go ahead and get right into it. My objectives today are going to be over what it's about, the ELINX uses today, the purposes for it and what they do, the barriers, the benefits, and how it tied into our readings for the week. So in February 2005, the California Healthcare Foundation initiated the EHR Lab Interoperability and Connectivity Specifications, which is the ELINX project. Their goal was to develop a standard way of delivery for electronic lab results for outpatient labs to the EHR systems, which resulted in the ELINX 1.0. There are now further versions that have been created since then with new updates based off of things that they have seen that needed to be adapted to what the healthcare clinics and hospitals have done. So although it was created by experts then with the research that it was done, it wasn't tested, the standard wasn't used. So the CHCF funded 5 pilot projects within hospitals to test the standard. So these are those pilot projects. If you want to pause and read it and go forth, please do that. Challenges and solutions that the pilot projects found within the ELINX 1.0, these issues and came with learning the new coding scheme that it came with, the lack of standard that the hospitals already had, resolving incompatible data fields from the hospital to the ELINX standard, and stretching ELINX beyond its defined capabilities, which was eventually resolved. Thus, also ELINX creating the ELINX 1.1. So they also resolved those issues by creating the 1.0 and creating time restraints within the specific standards and uses that it gave. Today, ELINX uses and it is specifically defined as the EHR Lab Interoperability and Connectivity Specification. It standardizes the formatting and coding of electronic messages exchanged between clinical laboratories and ambulatory electronic health records. Systems. So that is a specific definition that I got off of this PDF that came from this site. That is what it is defined as of today. It is an example of a clinical data standard which is agreed upon set of rules that allows information to be shared and processed uniformly, whether that data is received or transferred over or given. This provides a common language for both patients and providers. Adopting these standards helps providers deliver the right care by making information available at the right time. ELINX was also adopted by HL7, which is internationally recognized standards development organization for health information. HL7 is also responsible for the outgoing maintenance and further development of ELINX as of today. So barriers that we see today still are that even though it is adopted by an internationally recognized organization who oversees the standards and makes sure that everything is uniformly available and adopted, it's not uniformly available and adopted. People still have a hard time recognizing these standards and putting them into place. Most health information is shared in an antiquated paper-based form that cannot be captured, that cannot capture important clinical information, such as reminders and prompts given by physicians. So it is very hard to put that into an electronic format. Because there is a lack of a specific standard within this hospital organization or any hospital organization, there typically has to be time devoted to understanding and agreeing on the electronic health record systems and the information being used. This also will cost up your drive up your cost, I'm so sorry, and can be very inefficient. And so there's still today, even though this has been out for many years, a hard push to get these standards in place in every hospital. Benefits to the adoption of eLinux in health records. It improves the patient or practice efficiency because it is a standard across all. It is easier implementation of health electronic record systems, improved quality of care because it allows for a uniformly recognized language, more efficient reporting between labs and multiple health electronic record systems, once again, because it's got that uniformed recognized language, faster delivery of test orders and results in a reliable and cost-efficient method, and it achieves meaningful use. And then how it tied into our weekly readings. I'm sorry if you can't read that. Put myself down here. From chapter 9, which is what covers our standards, since chapter 10 covered security. Chapter 9, it talks about how in order for an organization to achieve interoperability, portability, and data message exchange, the health information system must adopt standards. Chapter 9 is titled Health Information System Standards. And so those three main categories are classification, vocabulary, and terminology standards, data exchange standards, and health record content standards. And as you can see right here, the HL7 falls under data exchange standards and health record content standards. And just by having eLinux as a part of those standards and a part of being that usage, it allows for a clean, recognized, uniform standard across all platforms. And then lastly, I have my references. There were two PDFs or files that it gave me within this source, so I put them both. And then of course, chapter 9 from our text. If you have any questions or want any further information, please ask me. I will be happy to give you the best answer that I can. Thank you for listening.